Let's discuss your dental plans. As you can tell, the first three columns, the first three plan designs, CB+, FB, and High Deductible Health Plan B, all have the same basic dental plan, which is $3,000 benefit each calendar year, January through December, for each person on your policy. Your major cleaning work is covered at 100% with no deductible. Your basic work, such as your root canals and fillings, are covered at 80% after deductible. And then your major work, your crowns, your dentures, bridges, are covered at 50%. Again, the maximum the trust is going to pay in any one calendar year will be $3,000 as a dental benefit on your behalf. CB, because it has the plus next to it, also contains a $2,000 lifetime orthodontic benefit. Regardless of age, it is a $2,000 lifetime benefit. Going to the far right, we have the legacy plan, which has no deductible on dental and a calendar year benefit of $2,000. It too has the 100% coverage for preventative care services, 80% coverage for basic work, and 50% coverage for major work. It also has a $2,000 orthodontic benefit, but that is limited to children under the age of 19. All four plans have the exact same vision benefit. By seeing one of our VSP providers, you pay nothing for your exam. If you need frames or lenses, you pay a $25 material copay. You can get a pair of frames every single year, or you can get 2 pairs every other year. We do have a contact in lieu of frames available for you, where up to $170 can be used towards the purchase of contacts. All been waiting for. Thanks for talking to me about the plan designs, but how much is this going to cost? As we mentioned earlier, JEA takes the premium contribution from the school district and they spread that amongst all four plan designs, and they also spread it amongst the different tiers. Our tiers are employee only, employee spouse or domestic partner, employee child or children, so no spouse, no domestic partner, or employee and family, which means employee, spouse or domestic partner, and children. Again, we care not who's in your household. When we talk about the tiers, we talk about who is enrolled on your policy. Children are eligible to stay on the plan until the age of 26. You are not required by PhD to keep them on your plan, but you do have the option of keeping them on your plan until they age out at 26. We look at the monthly coverage, which is what Juneau School District is going to pay back to PHT on your behalf, which is different than what's being deducted out of your paycheck because you're not having payroll deductions during the summer months. Your payroll deductions do begin, I believe, in September or the month that you were effective with your coverage. The monthly cost for employee only on Plan CB is $242.96 for employee only. If we drop down, we can see that employee only would have $138.83 deducted from their paychecks. As we discussed, Plan CB has a lower deductible than Plan FB, so it's more expensive. Plan FB for employee only has a cost of $160.36 every month. It's deducted out of paychecks over a 21 paycheck cycle. Those deductions are $91.63. JEA is offering $0 premium for employee only on the high deductible health plan. So if you are only enrolling yourself and you are selecting the high deductible health plan, your insurance will be provided to you at no cost. The legacy plan, which has that low deductible of $50, is the most expensive plan. Employee only has a cost of $353.06 on a monthly basis, or taken out over 21 paychecks, a cost of $201.75. I've gone through the employee only tiers. You can see which tier would be unique to your family design, who you are enrolling on the plan, for you to see what the monthly impact on your paychecks would be. I was discussing the plan designs earlier. I referred to in-network and out-of-network. Out-of-network has a significantly lower benefit, meaning that I will pay an out-of-network provider what's considered Medicare rates plus 25%. By using an in-network provider, we've already negotiated and agreed to rates with them, and you would have not more than your deductible and your co-insurance experience. It is critical that you select in-network providers. Great, Rhonda, how do I go about finding one? On our website at PEHTAK.com, we have our link to the Aetna Signature Network, Aetna Signature Administrators Network, as well as our list of companies that we have direct contracts with as well. This is a great time to acknowledge that we are not Aetna. I rent the Aetna network to get discounts so that when you go to Bartlett Hospital, we know that Bartlett Hospital is going to be in network because they participate in the Aetna network. But your claim does not get administered through Aetna's system. It's submitted to EBMS, our third-party administrator, in accordance with the benefit plan designs selected by your trustees. Again, use of an in-network provider is critical. Locating the in-network providers in your area or in your area in the lower 48, because Aetna is a nationwide network, is available by going to our website, clicking on the tile for Find a Preferred Provider, and searching the Aetna Signature Administrators Network. As well as on our website, we have the list of providers, several in the Juneau community, who do not wish to negotiate or discuss with Aetna, but they want to support public education employees, and we have established direct contracts with their offices. Unfortunately, not all medical care that is needed is available in our local communities. PHT has a non-emergency medical travel benefit, meaning that twice in a calendar year, individuals who need medical care outside of their community will be reimbursed for their airfare to the nearest location where that medical care can be provided. It does come with some criteria. This is here you can see the form that we use to access this benefit. This form must be submitted to PHT prior to travel. It's critical this form arrive in our office prior to travel beginning. The top half of the form you fill out, indicating all the information on who is traveling, the dates they are going, confirmation that your ticket was purchased 14 days in advance, why you're needing to go, what the purpose of the trip is. The lower section is your referring physician. Why do they want you to go outside? Is the care that you need not available and your doctor locally has recommended that you seek care, perhaps at Seattle Cancer Care Alliance or Virginia Mason in the lower 48? The referring doctor would complete this lower section at the bottom, indicating that this service is not available in the local community. You would send this form along with a copy of your purchased ticket to our office in Anchorage. The address is at the bottom. You can fax it or mail it into us prior to your travel beginning. We will then review it, and when approved, you would then be submitted a form back that you would use as your voucher. When your trip was completed, you attach a copy of your boarding passes to that form and submit them to us for reimbursement. Again, subject to deductible and co-insurance, but reimbursement of your airfare.